Have you ever wondered if a habit you've followed for decades could slowly be working against your body without you even realizing it? Most men over the age of 60 are never told that the techniques they learned when they were younger may no longer suit the body they have today. Instead, they continue doing exactly what has always felt normal, using the same pressure, the same speed, and chasing the same outcome. But here's what many people don't understand. Your body changes as you grow older. If your habits never change along with it, something that once felt natural can slowly lead to discomfort, reduced satisfaction, frustration, and even long-term physical problems. Repeating the wrong technique year after year can gradually affect healthy blood circulation, reduce nerve sensitivity, and quietly weaken your confidence without you noticing the process. The good news is that this doesn't have to happen. Today, we're going to talk about simple adjustments that can make a real difference in protecting your health while helping you enjoy greater comfort and confidence for years to come. I'm Dr. Jocelyn, and for more than 7 years, I've dedicated my medical practice to men's health, healthy aging, and sexual wellness. Throughout those years, I've spoken with countless men who believed something was seriously wrong with them, when in reality, their bodies were simply changing exactly as nature intended. In today's discussion, I'll explain how to safely adapt your self-touch routine so it supports your body's natural changes instead of working against them. My goal is to help you protect your circulation, preserve healthy nerve function, and maintain both your physical comfort and your sense of dignity as the years go by. But before we begin, I'd like to ask you for one small favor. If you're finding this information helpful, take a second to press the like button. It helps this video reach more men who may need this advice but have never heard it before. And while you're here, leave a comment below telling me where you're watching from. I truly enjoy seeing people from different parts of the world coming together to learn more about taking care of their health. Now let's begin with a question that many older men think about but rarely feel comfortable asking out loud. Why does self-touch suddenly feel different after the age of 60? This is one of the most common concerns I hear in my office. Men often sit across from me looking worried, convinced that something inside their bodies has stopped working properly. They'll tell me, "Doctor, I used to reach climax in just a few minutes, but now it takes much longer." Others say, "I don't seem to feel the same level of sensitivity anymore. Have I lost something?" Some even ask me if they're slowly losing their sex drive altogether or whether this means they're no longer healthy. These concerns are completely understandable, because many people have been taught to believe one very harmful myth, that getting older automatically means losing sexual function. But that simply isn't true. Aging does not automatically mean dysfunction. Aging means adaptation. Your body is not betraying you. It is adjusting to a new stage of life. The techniques that worked perfectly when you were 25 years old were designed for a younger body. At 65 or beyond, your body communicates differently, responds differently, and often requires a different approach. That doesn't mean pleasure has disappeared. It simply means the path toward it has changed. Unfortunately, very few men are ever taught how to make those adjustments. Instead, they respond by gripping tighter, moving faster, and putting even more pressure on themselves to reach climax quickly. Sadly, that approach usually creates even more tension, more irritation, and more disappointment rather than solving the problem. So let's put the myths aside for a moment and look at what is actually happening inside your body from a medical perspective. Understanding these changes removes unnecessary fear and helps you respond in healthier ways. There are 3 major systems that naturally begin to change after the age of 60, and each one plays an important role in how your body experiences arousal and sensation. The first involves your hormones. Testosterone levels gradually decline over time. This doesn't erase sexual desire, but it often makes that desire less spontaneous than it once was. Instead of experiencing sudden urges throughout the day, many men notice that desire develops more gradually. That is a completely normal part of healthy aging. The second change involves blood circulation. The tiny blood vessels responsible for supplying the penis slowly become less flexible as the years pass. Because of this, erections may take longer to develop, and they can fade more easily if you're feeling distracted, anxious, or under pressure. The third change affects your nervous system. The nerve endings responsible for detecting touch don't transmit signals quite as quickly as they did decades earlier. A touch that once created an immediate response may now feel softer, slower, or require more time before the brain fully recognizes the sensation. Biologically, these are normal age-related changes. Emotionally, however, they can feel confusing because it may seem as though your body has suddenly rewritten the rules without warning you first. And practically speaking, it means that routines you've repeated for decades may simply no longer produce the same results they once did. The encouraging news is that many men discover something surprising once they learn how to adapt. By making a few thoughtful adjustments, they often experience not only greater comfort, but also deeper satisfaction than they expected was still possible. Now let's talk about the 5 quiet mistakes I see older men make during self-touch, and more importantly, the simple changes that can help correct each one. These are not mistakes made because someone is careless. They're usually the result of repeating habits that once worked perfectly well many years ago, but no longer match the needs of an aging body. Understanding these patterns can make a remarkable difference in both comfort and long-term health. The first mistake is continuing to use the same grip strength you've always used. When you were younger, firmer pressure may not have caused any problems because your skin was thicker, your circulation was stronger, and your tissues recovered more easily. But after the age of 60, the skin of the penis naturally becomes thinner and more delicate. The tiny blood vessels underneath are also more vulnerable than they once were. Holding too tightly or squeezing with excessive force can place unnecessary stress on these tissues. Over time, repeated pressure may contribute to small injuries that aren't immediately noticeable. These tiny changes can gradually reduce healthy blood flow and dull the sensitivity of the nerves. Biologically, repeated microtrauma encourages the body to protect itself by decreasing sensation in the affected area. Emotionally, many men begin believing they've permanently lost sensitivity or that something is seriously wrong. Practically, this can eventually make it more difficult to respond naturally to a partner's touch, affecting confidence and intimacy. The solution is much simpler than many people expect. Try relaxing your grip. Allow your hand to stay softer instead of squeezing tightly. Experiment with lighter pressure and different hand positions. Shift your attention away from force and begin paying closer attention to the quality of each sensation. Often, less pressure creates a far better experience than more. The second mistake is moving too quickly from the very beginning. As the body ages, the nervous system naturally takes a little longer to process physical stimulation. Many men mistakenly believe they should compensate for this by increasing speed. In reality, the opposite approach is usually far more effective. Rapid movement can overwhelm the signals traveling between the nerves and the brain, making stimulation feel weaker instead of stronger. Think of it the same way you would tune an older radio. If you rush through the frequencies, you'll only hear static. But when you slow down and make careful adjustments, the music becomes clear. Your body often responds in exactly the same way. Biologically, slow and consistent stimulation gives your nerves enough time to communicate effectively with your brain. Blood flow also has more opportunity to build naturally, instead of being interrupted by tension or frustration. Emotionally, slowing down allows you to stay connected to the experience rather than becoming focused only on reaching the finish line. Practically speaking, allow arousal to build gradually. Give your body permission to warm up at its own pace. You may be surprised to discover that patience often creates stronger sensations than speed ever could. The third mistake is skipping lubrication altogether. This is one of the most overlooked subjects I discuss with my patients, because many older men mistakenly believe lubricants are only necessary for women or for certain situations. The reality is quite different. As testosterone levels slowly decline with age, natural moisture also decreases in men. At the same time, the skin becomes thinner, more fragile, and more likely to become irritated by repeated friction. Dry stimulation may seem harmless in the moment, but over time, it can create tiny tears in the skin, mild inflammation, redness, soreness, or discomfort that may not fully appear until the following day. Biologically, using a quality lubricant helps protect delicate tissues, reduces unnecessary friction, and allows nerve endings to respond more comfortably to touch. Emotionally, it removes discomfort that can distract you from the experience and replaces it with greater ease and relaxation. Practically, I recommend keeping a simple, fragrance-free, water-based lubricant nearby. Apply it early rather than waiting until discomfort appears. Think of lubrication as part of preparing your body, not as something used only at the very end. This small adjustment alone can dramatically improve comfort while helping protect your skin for years to come. The fourth mistake is treating climax as the only measure of success. Many men have spent decades believing every experience must end exactly the same way. They view climax almost like passing a test, and if it doesn't happen quickly, they assume they've somehow failed. But after 60, arousal often develops differently than it did in earlier years. Sometimes climax takes more time. Sometimes it arrives with less intensity. And occasionally, it may not happen at all. None of these situations automatically indicate a medical problem. In fact, placing intense pressure on yourself often has the opposite effect of what you're trying to achieve. When you become anxious or frustrated, your body releases stress hormones that directly interfere with the natural processes involved in arousal. Biologically, these stress chemicals compete with the signals responsible for pleasure, making climax even more difficult to reach. Emotionally, this cycle creates disappointment, self-doubt, and sometimes unnecessary feelings of embarrassment or shame. Practically, it's helpful to redefine what success really means. A satisfying experience doesn't always require climax every single time. Sometimes success simply means feeling relaxed, comfortable, connected to your body, and free from unnecessary pressure. When you remove unrealistic expectations, many men actually discover that their body responds more naturally than it did when they were trying so hard to control every outcome. The fifth mistake is ignoring what your body is trying to tell you. After following the same routine for decades, many men begin operating almost entirely on autopilot. They repeat the same movements, the same pace, and the same sequence without really paying attention to how their body is responding in the present moment. But after the age of 60, listening to your body's feedback becomes one of the most valuable habits you can develop. If something begins to feel dull, don't automatically increase pressure. Instead, pause and make small adjustments. If an area feels uncomfortable or irritated, don't push through it. Give your body permission to stop and recover. And if you discover a type of touch that suddenly feels more comfortable or enjoyable than expected, stay with it instead of rushing ahead. Biologically, responding to your body's signals helps protect healthy nerve function and encourages better circulation by avoiding unnecessary strain. Emotionally, it strengthens the relationship you have with your own body, replacing frustration with confidence and trust. Practically speaking, the goal is no longer to perform according to old habits. The goal is to explore with patience, curiosity, and respect for the body you have today, rather than the body you had 40 years ago. So what does a healthier self-touch routine actually look like after 60? Let me walk you through an approach that many of my patients have found both comfortable and effective. It begins before you even touch your body. The first step is choosing the right moment. Don't squeeze the experience into a few rushed minutes between other responsibilities. Give yourself at least 15 to 20 minutes of uninterrupted privacy. Your nervous system responds far better when it feels calm instead of pressured. The next step is preparing your environment. This may sound simple, but your surroundings influence your body's response more than many people realize. Soft lighting, a comfortable chair or bed, a relaxed posture, or even quiet background music can help your brain shift away from stress and into a more peaceful state. When your mind feels safe and relaxed, your body is much more likely to respond naturally. Before touching anything, spend a moment focusing on your breathing. Take 5 slow, deep breaths. Allow each inhale and exhale to become steady and relaxed. This simple practice sends an important message to your nervous system. It tells your body that you're safe, that there's no need to rush, and that you can remain fully present throughout the experience. Once your body begins to relax, apply lubrication early rather than waiting until you think you need it. Don't think of lubricant as something that's only useful near the end of the experience. Instead, make it part of the beginning. Allow it to soften the skin, reduce unnecessary friction, and gently warm the tissues before increasing stimulation. From there, begin exploring slowly. Rather than moving immediately toward the area that has always felt the most sensitive, imagine that you're giving your body a gentle massage. Experiment with lighter pressure, different hand positions, slower rhythms, and small changes in movement. Give yourself permission to discover what feels comfortable now instead of assuming the same techniques from years ago are still the best choice. Remember, your body has changed, and that's perfectly normal. If at any point your level of arousal begins to decrease, don't panic. There's no need to force it back or become frustrated. Simply pause for a moment. Continue breathing slowly and allow your body to respond in its own time. Very often, when you remove pressure and remain patient, arousal returns naturally without needing to force anything. Your breath continues to play an important role throughout this process because steady breathing supports healthy blood flow, keeps your nervous system calm, and helps your mind remain focused on the present instead of worrying about the outcome. Even your body position deserves attention. Many men don't realize that sitting hunched forward on a hard chair for long periods can place unnecessary pressure on the pelvic region and compress important nerves. That pressure may reduce comfort and affect the quality of sensation without you even recognizing the cause. Instead, try reclining slightly, lying comfortably on your side, or placing a pillow beneath your legs to reduce strain and improve support. Small adjustments in posture can sometimes make a noticeable difference in circulation and overall comfort. I also want to address something that many men hesitate to talk about: using supportive devices. Products such as warming sleeves or textured aids are sometimes misunderstood because people assume they're childish or unnecessary. In reality, they are simply tools designed to support a body that has naturally changed with age. Think about reading glasses. Most people don't view them as a sign of weakness. They're simply a practical solution that helps the eyes function more comfortably. These supportive devices can serve a similar purpose by providing different types of stimulation while reducing excessive strain on your hands and sensitive tissues. There's absolutely no shame in using tools that help you care for your body in a healthier and more comfortable way. Now I'd like to discuss something that is every bit as important as learning the right technique, and that's knowing when it's time to speak with a doctor. While the majority of the physical changes we've talked about today are completely normal parts of aging, there are situations where your body may be trying to tell you that something requires medical attention. One of the healthiest habits you can develop is learning the difference between expected changes and warning signs that shouldn't be ignored. Far too many men wait until a problem becomes severe before asking for help. They assume discomfort will simply disappear on its own, or they feel embarrassed bringing up personal concerns during a medical appointment. But the reality is that early conversations often prevent much larger problems later. Paying attention to your body's signals is not a sign of weakness. It's a sign that you're taking responsibility for your long-term health. The first warning sign I encourage every patient to watch for is persistent pain or a burning sensation during or after self-touch. Temporary mild sensitivity may occasionally happen, especially if there has been too much friction. But pain that continues or returns repeatedly should never be dismissed as normal aging. It may be a sign of irritation, inflammation, or even a minor infection that deserves proper evaluation. Addressing these concerns early is usually much simpler than waiting until symptoms become more severe. The second sign involves sudden or ongoing numbness. As we've discussed, it's perfectly normal for sensation to change gradually over the years. However, if you notice a sharp decrease in feeling over a short period of time, or if numbness continues without improvement, it's important to have it evaluated. In some cases, this may suggest involvement of the nerves or another condition affecting healthy sensation. The sooner these issues are identified, the more treatment options may be available. The third situation involves difficulty achieving or maintaining erections, even when you're completely relaxed and alone, without stress or outside distractions. Occasional changes happen to nearly every man, and there's no reason to panic over isolated experiences. But if this becomes a consistent pattern, it may point towards circulation problems, hormonal changes, or another medical condition that deserves attention. Erectile function is closely connected to overall cardiovascular health, which means changes in this area can sometimes provide valuable information about your body's general well-being. Rather than viewing it as something embarrassing, think of it as useful feedback from your body. The fourth warning sign is emotional distress. This is one that often receives far less attention than it deserves. If feelings of shame, anxiety, frustration, or sadness begin to dominate your experience, don't ignore them. Emotional health and physical health are deeply connected. Constant worry can increase stress hormones, interfere with healthy arousal, reduce confidence, and create a cycle that's difficult to break without support. Talking openly with a healthcare professional can often provide reassurance, practical guidance, and treatment options that many men never realize are available. I want to emphasize something that I tell my patients every single week. Scheduling an appointment with a urologist doesn't mean you've failed or that something is seriously wrong with you. It simply means you're making your health a priority. In fact, many visits end with reassurance that the changes being experienced are entirely normal and manageable with a few simple adjustments. Even a brief conversation can answer questions that have caused unnecessary worry for months or even years. You don't have to wait until you're facing a crisis before asking for advice. Preventive care is one of the most valuable parts of modern medicine. By discussing concerns early, you give yourself the best opportunity to protect your health, maintain your quality of life, and avoid complications that might otherwise become more difficult to treat. Remember, seeking guidance is a sign of wisdom, not weakness. The men who enjoy the healthiest aging are often the ones who ask questions before small concerns become larger problems. Taking care of yourself isn't something to feel embarrassed about. It's one of the greatest investments you can make in your future well-being. As we come to the end of today's conversation, I want you to remember one simple idea above everything else. Self-touch after the age of 60 is not about trying to force your body to perform exactly as it did when you were 25. That stage of life has passed, and there's nothing wrong with that. Healthy aging is about learning to work with your body instead of fighting against it. It means adjusting your grip instead of tightening it. It means slowing your pace instead of rushing. It means paying attention to your body's signals instead of ignoring them. And perhaps most importantly, it means letting go of outdated beliefs that define success only by reaching climax as quickly as possible. Your body has not failed you. It has simply evolved. Like every other part of healthy aging, it deserves patience, understanding, and care. When you respond with respect instead of frustration, many men discover that pleasure becomes not only possible again, but even more relaxing, mindful, and personally meaningful than it was in earlier years. Aging doesn't have to mean giving something up. Often, it simply means discovering a healthier and wiser way of experiencing it. Never forget that growing older is not the end of vitality. Your body still has an incredible ability to respond, adapt, and recover when you give it the support it needs. Small changes in your daily habits can protect your circulation, preserve healthy nerve function, reduce unnecessary discomfort, and help restore confidence that may have slowly faded over time. Every positive decision you make today becomes an investment in your health tomorrow. You deserve to feel comfortable in your own body, and you deserve accurate information instead of outdated myths that create unnecessary fear. If today's discussion helped answer questions you've been carrying for a long time, I'd truly appreciate your support. Please take a moment to press the like button, because every like helps this information reach more men who may be struggling with the same concerns but don't know where to find trustworthy guidance. If you're new to the channel, subscribe and turn on the notification bell so you never miss future conversations about men's health, healthy aging, sexual wellness, and practical medical advice designed to help you live with greater confidence and peace of mind. And before you leave, I want to point you toward another important topic that many men overlook. Even if you've improved your technique and made all the healthy adjustments we've discussed today, there is still one silent daily habit that can influence your prostate health if you masturbate regularly. Most men never recognize its impact until symptoms begin to appear, and by then, they often wish they had learned about it much sooner. That's exactly why I've prepared another video explaining what daily self-touch can do to your prostate over time, which warning signs you should never ignore, and the practical steps you can take to protect yourself for the years ahead. I strongly encourage you to watch it next, because understanding this information may help you avoid problems before they ever begin. Thank you for spending these moments with me and allowing me to be part of your health journey. As always, take good care of yourself, continue making informed choices, and remember that every positive change, no matter how small, has the power to improve your quality of life. Stay healthy, stay hopeful, and keep moving forward with confidence. I'm Dr. Jocelyn, and I look forward to seeing you again in our next conversation.